The landscape of artificial intelligence deployment in healthcare presents a wealth of opportunity. But it also raises questions of efficacy and safety, with organisations and regulators struggling to keep up with the rapid advancements of the capability of AI. We are a team of experts in AI research from Swansea University, quality improvement from TEC Cymru, health technology assessment from Health Technology Wales, and user experience from Bold Insight. And we evaluate projects that look at deploying AI within healthcare to maximise the safety and effectiveness of a system. Recent work has included the assessment of an AI supporting triage efficiency in general practice and clinical decision support from AI predicting a COPD patient's risk of hospitalisation. Through our research and experiences with AI, we've learned 3 important things that have become the foundation of our work. 1. AI, like all technology, creates ripples beyond its main goals. The impact of these ripples must be analysed alongside clinical endpoints within the healthcare environment. Critically, evaluations that start early, are set in environments that reflect the real world, and are repeated over several cycles, can ensure the systems provide benefits rather than creating additional issues. 2. Adopting quality assurance and quality improvement techniques paves the way for more agile processes. Advancing from a standard product procurement concept to a continuous adoption and evaluation. This enables systems that function safely and effectively, leading to desired practice improvement. 3. Significant changes are needed in how AI in healthcare is developed and adopted. Design work needs to be iterative, that is, having more design cycles to help get things right. Design also needs to be participatory, that is, involving not just AI experts, but having increased dialogue with healthcare professionals, patients, and wider stakeholders along a staged investment, development, and evaluation cycle. Our team aims to evolve the culture and practice of digital health systems development and evaluation. We believe government, healthcare, and technology leaders need to embrace algorithm transparency and fairness throughout the ecosystem. It is also vital to assign accountability across developers, clinicians, health boards, patients, and regulatory authorities to ensure inevitable concerns are properly addressed. When AI healthcare systems are developed well and deployed effectively, they can transform service delivery, improve a patient's lived experience, and save lives.